even if it's before 5 o'clock, it's 5 o'clock somewhere, right?
I don't think anybody is disposable. I don't think people are disposable. As long as there's a ray of hope, you shouldn't be disposable.
Alcohol use disorder is not really thought of as a chronic condition for which there is strong evidence that it can be successfully treated. We just don't think of it that way. So once you understand the science and that it can be successfully treated, then we can make some headway. And this adoption of these new approaches should accelerate. There's also, the medications themselves are largely off-label and generic. So there's no real strong incentive for a pharmaceutical company, for example, to be promoting something which is generic.
25 years ago, we had one medication to treat alcohol use disorder. So I think a lot of us followed the approach of a stern talk, maybe referring off to specialists, relying on community programs, but between those two endpoints, there was quite a monolithic approach where we didn't necessarily feel we had the knowledge to contribute.
In the past, we have our hand on our hip and we describe, we sort of indicate, yes, this is very serious and it's too bad you find yourself in this position, but it's, it's kind of your own fault, a little bit of that, and really how could you have been doing this to your family, and don't you see that the wagging finger comes out? And so what that's caused is people don't think that there's anything that can be done other than what they've already been trying to do, which is stop drinking.
And when I first heard Dr. Harry's talk about these medications, I was absolutely blown away, because it seemed impossible that there was something so accessible as these medications that could be this beneficial.
I've been using the new approach for some time now, and since then I've implemented it in my practice and found the response to be very good.
Harm reduction is often, as a philosophy, is often misunderstood. I think it needs to be seen as a continuum of services. So for each individual, that's going to look really different. Harm reduction for one person might look quite different than for somebody else. I think it's about treating a person with compassion and meeting them where they're at, and then wrapping services around them to help them move along in their recovery journey and reduce the harms that the substance use might be creating in their life.
What has transformed the whole approach to alcohol use disorder is having something to offer to help support people. They still need the counseling. Treatment center can still be extremely beneficial. However, they have some medications that we can offer that will help them achieve their goals of either abstinence or controlling their drinking, cutting down, and choosing how much they drink.
Probably the clearest set of evidence in Canada comes from the BC Centre for Substance Use. So their report looked at the treatment of alcohol use disorder and high-risk drinking and suggests a certain approach using medications. They list 4 medications, naltrexone and acamprosate, as first-line medications, and their second-line medications are topiramate and gabapentin. These medications have been proven to work time and time again over a long period of time, and that's what we're trying to convey to people, that there are these available approaches to treatment, this new approach. It's proven scientifically to be successful, and there's on-the-ground evidence as well that says these things work.
And it's a matter of choosing the most likely one, and that likely will work, but if it doesn't, you don't kick the person to the side of the road and say, tough luck.
It depends on their background, their substance use history, their medical history, family history, a few factors we would look at when deciding on medication, but in short, most people would benefit from it.
For a lot of people, the concept of quitting drinking entirely can be so daunting. It may ultimately be their goal, but their goal as they're sitting there contemplating setting out in this journey can be just to have control, to be able to say, I choose to only have this many drinks.
This new approach allows patients to set goals which they can determine how much they might drink. It may not be to be abstinent. They can actually choose to reduce their drinking or gain control over their drinking.
The AUD medications can be prescribed by anyone who has prescriptive authority. So nurse practitioners, family doctors, any specialists, and some pharmacists as well can prescribe them.
These medications are not taken forever. On average, people may use it for 3 to 6 months. Some may choose to use it for 12 months or longer, but it's not typical.
People do not have to stop drinking.
Detox is not required before starting most of these medications.
We believe a good source to keep up with the latest evidence is through the Canadian Alcohol Use Disorder Society website. And that will contain current information and new information as it becomes available.
Yeah, it gave me the ability to move forward with my life in all aspects.
Every step got easier. Every step got easier as you gain confidence in yourself.